Hi, I'm Nora, and I'm joined here with
Grace Nichol. I was one of the attendees of the World One Health Congress. I'm a PhD candidate in population medicine and One Health.
And what was the research that you presented in Singapore?
Yeah, so I presented on my PhD research on tick range expansion in Western Canada. So I'm looking at Dermacentor ticks specifically, and traditionally in those Western provinces, we've seen Dermacentor andersoni ticks live there. But now we're detecting a new species of tick, and we're currently doing lab testing to see if it is Dermacentor variabilis, which would suggest westward range expansion of that tick, or if it's Dermacentor similis, which is a newer species of tick that would represent northward range expansion into Canada from the States.
What introduced you to One Health?
Yeah, so I was first introduced to One Health as an undergraduate student at Guelph, and I worked with my current advisor actually on a different species of tick. So I was looking at canine Lyme disease, and that introduced me to the idea of vector-borne zoonoses and how important that is in One Health. And I liked it so much that I decided to continue into a graduate program, but now focusing on a different species of tick.
And did your perception of One Health change after your trip?
I'd say that my perception was the same, but my ideas of One Health were really broadened. So I got to see some of the ways that One Health were applied outside of my area of research. So it was really exciting to see what other One Health projects people are working on.
And what does One Health mean to you now?
One Health to me would mean striving for optimal health for humans, animals, and the environment, and also with a focus on collaboration. So yeah, that's what One Health means to me.
What was the best question that you received when presenting your research?
Yeah, so actually my favorite question that I received was about how we engaged our stakeholders. So to get our preliminary data for my research, my lab worked on this Canadian pet tick survey, and we had to engage veterinarians and people working at veterinary clinics to get all of our data. So I loved that question because I thought it showed how there was a lot of interest in engaging stakeholders in One Health research. I didn't actually have a great answer for them because how we engage stakeholders happened before I started my program, but it led to a really just interesting conversation about engagement and how to get participation in One Health studies.
And how did you like Singapore?
I really liked it. It was my first time traveling to Asia, and it was super exciting to have some time outside of the conference to explore Singapore a little bit and visit the gardens by the bay. That was my favorite part.
So what are two takeaways or pieces of advice that you would give someone?
Yeah, so the first thing I would say is definitely try to learn about One Health work outside of your area of expertise. I find especially in grad school, it's really easy to just focus on your own research area, but it was really interesting to hear about other One Health work and like broadening my perspective. And my other piece of advice is don't be afraid to network. I know it's super intimidating, but you never know what connections you might make. And for me, it led to some really interesting discussions and meeting with some people who I wouldn't have been able to meet with who do actually really similar work to myself.